Hector, thank you. 1 in 8 women will develop breast cancer during her lifetime. That's according to the American Association for Cancer Research.
And that is a really important reminder that October is Breast Cancer Awareness Month. New this morning here in the Treasure Valley, St. Luke's Health System has some new procedures to help detect breast cancer. Tyson White talked to a doctor at St. Luke's about this new tech. Tell us about it.
Maggie, Justin, the Food and Drug Administration just updated their mammography quality standards in September, stating patients be notified about their breast tissue density. St. Luke's Medical Director of Breast Care Services, Dr. Wee Pham, says the health system has a few new procedures to help further detect cancer in dense tissues.
These supplemental screenings do not replace yearly mammograms. That is still the gold standard.
St. Luke's is offering 3 additional breast cancer screening procedures to help identify cancerous tissue in dense breasts.
This empowers women to know if their breast density is dense or not. If they are dense, they may benefit from additional supplemental screening. So these cancers and lesions can hide inside the glandular tissue. So the goal of these supplemental modalities is it helps us see through the breast what the mammogram cannot see.
The first of the 3 imaging procedures is an abbreviated MRI. It is the most sensitive and shortest, involving a contrast IV and scan in an enclosed MRI machine.
We have something called contrast enhanced mammography. That's very similar to a regular mammogram, but it uses an IV as well, using contrast. The benefit to that is they're in a familiar setting. They get a mammogram every year, so it's very familiar. It's quick and easy. It's only a couple more minutes than their normal mammogram. Then our last modality is whole breast ultrasound. That's a quick and painless one. It doesn't require an IV, and it looks at the whole breast and it's automated.
Dr. Pham says these additional screenings give patients peace of mind in knowing their diagnosis.
Patients may feel embarrassed to talk about it, or it's maybe a little taboo, but it's not. The more we talk about it, the more barriers we break down, the more knowledge there is throughout the community.
And men are also at risk for breast cancer. The American Association for Cancer Research says more than 2,700 men will be diagnosed with breast cancer this year. So if it's been a while since your last mammogram or you've just been putting it off, Dr. Pham says now is the time to schedule one. We'll have some helpful links to information regarding breast cancer screening in the story on our website at ktv.com.
All right, really important to schedule those mammograms and get checked. Thank you so much, Tyson.